before we go further today, that the Democratic congressional leaders and you, Mr. President, renounce this idea of going back to the Congress and jamming through on a partisan vote through a little used process we call reconciliation, your version of the bill. You can say that this process has been used before, and that would be right. But it's never been used for anything like this. It's not appropriate to use to write the rules for 17% of the economy. Senator Byrd, who is the constitutional historian of the Senate, has said that it would be an outrage to run the health care bill through the Senate like a freight train with this process. So this is the only place, the Senate, where the rights of the minority are protected, and sometimes, as Senator Byrd has said, the minority can be right. I remember reading Alexis de Tocqueville's books, which most of us have read, and he said in his American Democracy that the greatest threat to the American democracy would be the tyranny of the majority. When Republicans were trying to change the rules a few years ago, you and I were both there. Senator McCain was very involved in that, about getting a majority vote for judges. Then Senator Obama said the following: what we worry about is essentially having two chambers, the House and the Senate, who are simply majoritarian, absolute power on either side. That's just not what the founders intended, which is another way of saying that the founders intended the Senate to be a place where the majority didn't rule on big issues. I mean, Senator Byrd in his book, Senator Reid in his book, writing about the Gang of 14, said that the end of the filibuster, requiring 60 votes to pass a bill, would be the end of the United States Senate. And I think that's why Lyndon Johnson in the 60s passed the civil rights bills in Everett Dirksen's office, the Republican leaders, because he understood that having a bipartisan bill not only would pass it, but it would help the country accept it. Senator Pat Monahan has said before he died that he couldn't remember a big piece of social legislation that passed that wasn't bipartisan. And after World War II, in this very House and the room back over here, President Truman and General Marshall would meet once a week with Senator Arthur Vandenberg, the Republican chairman of the Senate Foreign Relations Committee, and write the Marshall Plan. And General Marshall said that sometimes Van was my right hand and sometimes he was his right hand. And we know how to do that. I mean, John Boehner and George Miller did that on No Child Left Behind. Mike Enzi and Ted Kennedy wrote 35 bills together. You mentioned that in your opening remarks. You and I and many other senators worked together on the America Competes Act. We know how to do that, and we can do that on health care as well. But to do that, we'll have to renounce jamming it through in a partisan way. And if we don't, then the rest of what we do today will not be relevant. I mean, the only thing bipartisan will be the opposition to the bill. And we'll be saying to the American people, who have tried to tell us in every way they know how, in town halls and elections and surveys, that they don't want this bill, that they would like for us to start over. So if we can do that, start over, we can write a health care bill. It means putting aside jamming it through. It means working together the way General Marshall and Senator Vandenberg did. It means reducing health care costs and making that our goal for now, and not focusing on the other goals. And it means going step by step together to re-earn the trust of the American people. We'd like to do that, and we appreciate the opportunity that you've given us today to say what our ideas are and to move forward. Thank you very much.
Well, thank you, Lamar. Both I and Lamar went a little bit over our original allocated time. I not wanted to be a hypocrite. I wanted to give you some slack. We're going to have Nancy and Harry. I think my understanding is you guys want to split time.
We are.
We'll split it up, and so we'll let them make some quick remarks. What I will then do is just address. John, are you going to make the presentation yourself? Okay. What I will then do is just address a couple of points that were raised by you, Lamar, in terms of process, and then we will start diving in and getting to work. All right? Nancy?
Yes, Mr. President. Thank you very much for bringing us here today. I will try to stick to the time because we have many people to hear from. Thank you, Mr. President, again. It was almost a year ago, March 5th of last year, when you brought us together in a bipartisan way to set us on a path to lower cost, improve quality, and expand access to quality health care for all Americans. In the course of that time, in our committees, in the House and the Senate, we've had lively discussions. Here we are today. You began your remarks, Mr. President, by saying there was a glimmer of bipartisanship in the Senate with the passage of the jobs bill. I want you to know there was a blaze of bipartisanship in the House yesterday with, 406 to 19. We passed, under the leadership of Congresswoman Louise Slaughter, Tom Fioriello, Betsy Markey, and others, the repealing of the exemption that insurance companies have on health insurance and the antitrust laws for health insurance. 406 to 19, a very strong message that, yes, the insurance companies need to be reined in. So put us down on that side of the ledger. That day, March 5th, we all remember the bipartisan spirit, the hope that was in the room, and also when Senator Kennedy came into the room and declared himself a foot soldier in the fight for health care for all Americans. And then later he wrote to you and said, this is not just about the details of policy, it is about the character of our country. The character of our country is formed, the backbone of our country are our working middle-class families in America. As we sit around this table, I think we should be mindful of what they do when they sit around their kitchen table. What we do here must be relevant to their lives. And for them, they don't have time for us to start over. Many of them are at the end of the line with their insurance, with their caps, with their this and that. You talked about stories. Senator Alexander did too. I can tell you many stories as I travel the country where I've seen grown men cry. One man in Michigan, Mr. Dingle, told me that his wife had been sick for a long time. He was at the end of the line in terms of his finances. He might have to lose his home, and she was bedridden. He was afraid of what was going to happen. He was too proud to tell his children that he needed help because they were raising their own families. He said, when is something going to happen on health care in America? I can't hold out much longer. I have a letter from Michigan, seems to be where I get some mail on this subject since I've traveled there recently, that a woman who said that their family, when they have to pay their deductible, they have to subtract it from their food budget, and that's just one of the concerns she mentioned. Can't mention health care in Michigan without acknowledging Chairman Dingle, his institutional memory of how difficult it was to pass Medicare, how he has worked over the decades to improve it, how committed he is to preserving it, and how important a part of preserving Medicare is to passing this health care bill. Later, he will inspire us with that, but he, Mr. President, as you know, as a young congressman, gavelled Medicare into law in the House of Representatives. You have talked about how the present system is unsustainable for families, for businesses, large, modern, and large, small, any size, and how it's unsustainable, as you said on March 5th of last year. And health care reform is entitlement reform. Our budget cannot take this upward spiral of cost. We have a moral obligation to reduce the deficit and not heap mountains of debt onto the next generation. But I want to talk for a moment about what it means to the economy. Imagine an economy where people could change jobs, start businesses, become self-employed, whether to pursue their artistic aspirations or be entrepreneurial and start new businesses, if they were not job-locked because they have a child who's bipolar or a family member who's diabetic with a pre-existing condition, and all of the other constraints that having health care or not having health care places on an entrepreneurial spirit. Think of an economy with that dynamism of people following their pursuits, taking risks. We want them to take risks, and yet we lock them down. and we have an anvil around our businesses because of these increasing cost of health care.